Hello, my name is Gina Becker. I'm with Contigo Counseling and Coaching Services, and I'm here to talk to you about trauma. So in my last video, we talked about how the autoimmune system is connected to the flight and fight flee response, and which is also connected to the trauma. And I mentioned some interruptions that might take place. I started to talk to you about the effects of the hormones that are produced by the excess trauma. Okay. In addition, there's stress that starts to begin to be produced as a result of the trauma. The triggers that are associated to the trauma, or the memories that are associated to the trauma, tend to resurface, and that causes stress. Okay, all of this is done subconsciously, and there is an inability to recognize what is going on. I mentioned how important it is to stay present in that response mode, so that you can begin to iron out, so to speak, where that is coming from, what it is connected to, where did it originate, and how that is affecting you presently. So I said a mouthful there. Okay. And it sounds very easy in theory. However, you will need some coaching and some help, and that's why I'm here. I hope that I can first educate you and get you help you understand what is actually happening to you when you start feeling feelings of helplessness or hopelessness, and they seem to have come from nowhere, or you're feeling defeat or low self-esteem. Those are all responses, okay, that are connected. Those are emotional responses that are connected to the trauma, and the triggers, you might not be recognizing them. You may be recognizing them, and they will continue to plague you until the trauma is resolved. I mentioned how the trauma should have been resolved originally by by your caregivers, parents, who may have experienced trauma themselves, and it might have originated with them. Okay. So if I am speaking your language and making sense to you, please leave a comment. Maybe say something like, uh, please let me know more. Or if you need help, if you need assistance, I am doing on Zoom videos, Zoom counseling or coaching. I prefer that you come into the clinic if you have complex trauma, and we will talk more about that. Compound trauma, where you've had trouble in multiple areas and in different years. Okay. And then also you can join a group. You can do one-on-one counseling. You can do a Zoom group, and you can do sometimes telephonic, depending on what we're going to be talking about. Okay. Mostly talk therapy it's an excellent a source of support, but unfortunately it does not resolve the trauma. There's more work to do on that. Okay. And I started to say in my last video, it's important that you stay present while you are in that response, and begin to just kind of iron it out and unfold what is happening, and where did it originate. Okay. And sometimes there's layers. Okay. When I used to direct some recovery programs, I was often talking about the layers, and I used the analogy of the onion, and the onion how oftentimes, you start with the outside, which is very uh, crispy and paperish, but at the same time crumbly, and you have to pull that off, and that makes a lot of noise. Okay, and then you get to a thicker part of the onion, and you begin to unlayer it, and it becomes more and more tender. Sometimes you get to uh, uh, I think it's a membrane, where it's real slimy, a little bit slimy. So all of that is a great analogy of our own layers of trauma. Okay, so I hope that makes sense to you, and if not, ask me a question and leave me in the comments. If you haven't subscribed already, please do, and that way you can get the future videos. In addition, like my channel so that the algorithms with YouTube will continue to realize, okay, this is something that people want to see. Okay, thank you. So I wanted to go ahead and talk a little bit more about the hormone cortisol, which gets released into the system, and then it begins to cause trouble. I talked about some people start having physical problems. Oftentimes, you can, the body starts to respond to this hormone, which causes problems with immune system, diabetes, which also results in, because the cortisol settles in this belly, and then that causes hormonal issues with the diabetes and sugar levels. There's also the cortisol causes problems with joint and arthritis issues. So there's a lot of things, and we'll visit that in more in depth in the future. There's a lot of physical problems. Okay, in the early years, and even in the as an adult, you'll have trouble with thinking, cognition, memory problems. That's why you might have problems remembering things. You just can't remember. You can't focus because the cortisol will affect just so many areas, and then there's other hormones involved as well. What I'm trying to get at is that the point is that the trauma, when it's unresolved, starts to wreak havoc in our bodies, okay, and it burns the body out, okay. You've might have heard of adrenal gland fatigue, okay, and that is a real thing. There's other things like let's see, like fibromyalgia, and then of course the emotions. I mentioned hopelessness or depression or anxiety. There's also the mental health issues, depression, anxiety. Okay, so those are all connected to the trauma. Maybe low self-esteem, and then self-harm, a lack of interest, a lack of self-worth. Well, why even try? Why bother? That sort of attitude or response. Okay, so when these chemicals get released, which are stress hormones, they interfere with all of these. Okay, and the cognition, to the body health, the mind, the body. Okay, and the soul. Okay, so the emotions, as well as the spirit. Okay, so the spirit is even affected. Okay, the spirit does not have an ability to grow. Sometimes you are so traumatized, and this is complex trauma, that you become, and not necessarily always, some people do respond this way, where they become numb and they cannot, they can't feel. They have feelings of derealization, like, they just don't feel real. Um, if you are suffering from the most severe form of trauma, effects of trauma, which I mentioned in a video that I did a couple of videos ago, which is stage 5. You might dissociate. Okay, dissociating is when you leave your body, or you go into, like, you just kind of exit, and I mentioned things might look okay. You might function very well, but you are having trouble still. You're not really connected to yourself. Everything is separate, the body, the mind, the soul, and your body is too scary to be in. Okay, and so you learned how to exit the body. And so those are some responses to trauma, and the cortisol being flooding the brain and the body. Okay. So let's see. When trauma took place in childhood, of course, most of the time it was pre-verbal. It was prior to the ability to speak. And a lot of people struggle with, why can't, I just talk about this and it gets resolved? Uh, but when I go see a counselor, I can't even talk about it because I don't know what to say. I don't know how to say it. And that's because it's in the pre-verbal stuck stage. Okay, so you may have been even 5 years old. A 5-year-old does not know how to explain that they were sexually abused. Okay, and then so implicitly it doesn't make sense. That means inside your head you just don't, it doesn't make sense. And so explicitly, when you try to explain, it doesn't come out. You might, as you grow older, you might be able to find some words and say things like, you know, uh, uncle or auntie so and so were touching me, you know, but you don't. Oftentimes that comes very difficult, and not. And if you've been traumatized in that way, then what that feels like. It feels like it's just not. There's no words there. Okay. So again, if I seem to make sense, I hope that you are have already subscribed and have begun to uh, uh, write something in the comments. Consider contacting me, okay, in the comments, and I'd be happy to talk with you some further. I want to mention that I am going to begin a few more groups uh, and resume another group, or not resume it, just start it again, which is the Wounded Heart group. And this is a very intense group. It does deal with pretty severe trauma, complex trauma, mostly sexual abuse. Okay, and then I also have another group, Toxic Families, and I'll be doing that via Zoom as well as in person. Um, and then I have another group that I want to go ahead and do with boundaries, because oftentimes toxic families have trouble with boundaries. And when you have come from a toxic family, and we'll start breaking that down too, and all the different family roles, you might have already heard, there's the golden child, the scapegoat, the lost child. These are different roles that we tend to kind of fall into when we come from a toxic family. Okay, and so those are groups that I will be doing online. The Wounded Heart group is a little bit more intense, and that is going to be in person. And then I'm starting another group for dissociative identity disorder, and I will be doing a video that is separate to this series, okay, for each of those groups, to give you an idea of how each of those groups will, what each of those groups will be addressing. Okay, so again, I hope that you will contact me. My name is Gina, and my email is ginaprosper@gmail.com. And that's the word prosper, P like Paul, ROSPER, @gmail.com. And you're welcome to email me directly if you like. But if you leave a comment in the YouTube, it automatically goes to me. Okay. And it is a very confidential email. Thank you for viewing, and you have a beautiful day.